Okay, so let's talk about some verbal and nonverbal communication in nursing. First of all, we want to talk about how important it is to communicate well in nursing. You've all probably worked with a nurse who wants to just do their work and leave everybody else alone, and everybody leave them alone. And so their communication tends to be very challenging, right? They don't want to help. They don't want any help. They just want to be left alone. Nursing doesn't really work well that way. Communication is important for accurate identification of patient problems, to provide patient-centered care. If we don't communicate about that patient to the next shift or to other staff members, things get missed. To increase compliance, if we communicate, then everyone's giving the patient the same message. Communication decreases pain, anxiety, and stress in patients. Some effective communication techniques. If I want to gather more complete information, if I'm wanting to get more information and get deeper, I want to ask open-ended questions that leave room for that patient to talk. So instead of how much pain are you having, it would be, can you tell me about your pain? So I'm going to get more information usually with that second question. We can then, when we get some information, we can use the information we get to focus and clarify. You said that you're having pain in your leg. Can you tell me more about that? You want to use empathy with your patient, and you want to summarize what they're saying to make sure, remember that encoding, decoding thing? Don't forget about that feedback piece. That is checking in with that patient to make sure that you understood what they communicated. We can actually use the same thing with other nurses, with providers, with other departments. Communicating clearly can really decrease a lot of the conflict that goes on in a healthcare facility. Active listening is an important skill, and it helps us to gather more information about what's going on with our patient, but also can help us in dealing with conflict with coworkers. Active listening is about being present in the conversation. That's something that I struggle with and am still struggling with, and that's something that a lot of nurses struggle with, because we hear that alarm going on. We've got in our head the 3 patients we still haven't charted on. We've got to remember, oh yeah, that patient needed some pain meds, and I haven't checked on that patient that's a frequent fall yet. So it's very hard for us to stay present in the conversation that we're in. That's mindfulness. Don't allow yourself to interrupt when that person is talking. Wait till they stop talking. Listen to understand, not to reply. Gain as much information as possible through listening. Listen closely to determine the true meaning of communication. Detach from your personal beliefs and judgments. That's not saying you have to change what you believe, but try to understand the speaker's perspective. Separate what they're saying from your beliefs and judgments. Try to understand the speaker's perspective. Be aware of your biases and how they affect your perception of the client's communication. Listen with a desire to understand. Listen to understand, not to reply. Nonverbal cues. Think about nonverbal cues that indicate listening. An open posture facing the patient or facing the person. Lean slightly toward them, not heavily because that's kind of intimidating, but just lean a little bit toward them. Try to be at their level when possible. And use of silence. In particular, if people are communicating something that is difficult or painful, we want to fill in those spaces and make things feel better. Understand that most of the time we're not trying to make the other person feel better, we're trying to make ourselves feel better. So just sit in silence with that patient and give them time to get those feelings out. That can be helpful. Nonverbal communication in nursing. You need to think about eye contact and how your patient responds to that. Think about how you use touch. Does touch appear to be welcome to that patient? Do they withdraw or flinch when you touch them? So be very careful with how we use eye contact, touch. Be aware of how our body movement might be interpreted to a patient. Standing and hovering over a patient can feel intimidating. So our position in relation to the patient can affect communication, and our facial expressions. And this is also challenging when we've got a lot of other things going on. We may have this really awful facial expression because we're thinking about the 16 things we have to do. The patient doesn't know those 16 things. The patient has told you something, and now you're like, so what is the patient's interpretation of the message that you're sending? Use nonverbal communication to communicate caring to your client, but also observe the client nonverbals as part of your assessment. Here's an example of when a client nonverbal was incongruent with their verbal communication. This is a long time ago. I was in a patient room, and the patient was asking to be discharged. And I asked the patient about pain level. I said, the patient's pain. The patient said they had no pain at all. It was a fairly early post-op patient, I think 1 day post-op, but the patient's eyebrows were very drawn. They were very, very cautious with moving, splinting the abdomen, looked as if they were in pain, said pain level 0. So it's very easy to say, okay, I'm going to document this pain level 0. We're going to go on about our day. Patient goes home. So I pulled up a chair and sat down. And with students, this is one of the things that we are more likely to have time to do because I get to pick my patient load. I pulled up a chair and I sat down. And I said, I was very gently confronted the patient about that discrepancy. I said, you tell me that you're not hurting, but your facial expression looks like you're hurting. You're grimacing, you're holding your breath, you're holding your belly. Can you tell me a little bit more about what's going on? And it turned out that the patient was afraid of being kept overnight in the hospital because she didn't have childcare for the night, and she was afraid her children would be left alone for the night. So taking the time to pay attention to those nonverbals can give us some idea of how we can help that patient meet their needs. When we're listening, listen empathetically, listen to try to see things from the patient's perspective. Use silence to give them time to fill some things in. Pay attention to verbal and nonverbal messages, and communicate tolerance and acceptance to that patient. Okay, so I'm going to break again, and then we're going to talk about therapeutic communication, which is communication with specific purpose.